Good afternoon. My name is Kitty Behringer. I work with the Brain Injury Association of North Carolina. Thank you for joining me today at Follow the Turtle, Educate Yourself. Today, our topic is going to be Thanksgiving, COVID, and brain injury. My resources that I have using came from cdc.gov, brainline.org, and Brain Injury Association of North Carolina. Let me begin by telling you a little bit about COVID. And this information is, like I said, from the Center for Disease Control. First, I want to tell you that they currently have no vaccine to stop this infection or to keep you from being exposed. It is thought to be spread mainly from person to person by being in close contact with someone that either has the illness and is coughing, sneezing, or talking, or shows no symptoms at all. So it could be either way. CDC wants you to wash your hands often, 20 seconds at least, and then rinse with warm water, or to use a 60% alcohol-based hand sanitizer and rub your hands with that until they're dry. You are supposed to be washing your hands before you eat or before you prepare food for yourself or someone else. You are to wash your hands after you run to the bathroom or you return from a public place, blowing your nose or coughing or sneezing. You are to wash your hands after handling a mask, changing a diaper, caring for someone that's sick, or touching an animal or a pet. Inside a home, they advise you to maintain a social distance of at least 6 feet apart, especially for someone sick. Outside your home, also maintain the distance of 6 feet. And you can measure this by the length of your arms, twice the length of your arms. So that's an easy way to remember how to measure 6 feet. When you wear a mask, you are to cover your nose as well as your mouth so that you don't inhale the COVID virus through your nose or your mouth and inhale it into your lungs or swallow it into your body. The mask is meant to protect others from you because you may be carrying the infection and don't even know it. Everyone should be wearing a mask in public settings and when around people that they don't live with. Young children and someone that can't remove the mask themselves are not required to wear a mask. Do not use a mask for a health professional. They are made especially for those trying to take care of the sick with COVID. Continue to keep 6 feet apart and wear a mask and realize that the mask is not a substitute for social distancing. Just because you're wearing the mask doesn't mean that you don't have to be socially distanced. Cover your sneezes and your coughs with a tissue and immediately throw them in the trash and wash your hands or use a hand sanitizer. Do not spit, Do not throw tissues on the floor of a place that you are, or a restroom, or out the window when you're riding in a car. Monitor your health daily. Be alert for any symptoms that are symptomatic for COVID, and you can find those on the cdc.gov website. When you're running essential errands, be sure to wear your mask and keep 6 feet distance between you and other people. And if you feel like symptoms are coming on, take your temperature. And if it starts going up, then you need to call your doctor and seek professional help. The CDC also gives you ideas about travel, and their idea is to tell you to stay home. Do not get out. You take the chance of spreading COVID, and you take the chance of getting COVID by being out exposed traveling. And the Brain Injury Association is big on letting you know information about this, because crowds, loud noises, multiple conversations, and sometimes lights flickering in places are known to be problematic for people that have had brain injury. So it can be very overwhelming. It can cause sensory overload, which is a big thing in the world of brain injury. So you have to be careful about that. If you do decide to go, the CDC has also listed some places that are low risk as well as moderate and high risk. Low risk is staying home with your family or people that you're living with and celebrating there. Moderate risk is community meetings, such as in different yards, talking and celebrating like that. High risk is heavy shopping days, crowded parades, crowded buildings, large indoor gatherings. And when I saw large shopping days, I immediately thought of Black Friday right after Thanksgiving, because that's usually when a lot of people get out and there's a lot of noise, a lot of crowds, a lot of hustle and bustle. So just be aware that that's a high risk for getting COVID. Also, if you decide to travel, know the travel bans within states or places you're going. And just be aware, know where you're going, know the distance, give yourself plenty of time to get there, and just be very careful. And now I'm going to give you some hints from some brain injury survivors and psychologists, as well as our association, to help you decide on what you're going to do. The first thing that seems to be overall is to start planning what you're doing. And you've got about 2 weeks to plan. So I'm hoping this will be helpful information for you. Remember, you have to take care of yourself. Healing your brain is slow sometimes, and it will take time, and you will eventually get over some of the things that may be bothersome at first. Be organized, write down what you think you want to do, and then write down why you think you want to do it. And find out, is it something you feel obligated to, or is it something that you really, really cherish and it's very important to you? Some things that you might do in place of visiting would be have a Zoom meeting, have a phone call or a FaceTime chat, You can exchange holiday recipes. You could send pictures. You could write cards of people that you're grateful for those people. You can send those. Whatever you do, you have to prioritize what is most important to you. And whatever that is, keep it simple. Whatever you decide, remember your brain is having a process of healing, and it is trying to get things back together for you. So we need to do all we can to help our brains work correctly. Be sure to nourish your body with fluids and good foods when you are celebrating wherever you are. You have to help your brain and body function properly so that your brain can heal up and you can get over this brain injury stuff. So I'm just going to go over a few items that are on actual documents that we give out at the Brain Injury Association. Physical things you might deal with are fatigue, sleep disruptions. You might have seizures and need to take medicine for that. You might have headaches and pains in different areas of your body. Your coordination and balance could be a problem. As far as your thinking and processing, typically the brain processing is slower. You may not be able to return conversations that you'd like to, or you may not be able to process it in your head as quickly as you'd like to. There are mental fatigue when you're overloaded with a lot of stimulation, and it's like your brain just kind of freezes up and you just kind of sit there. Emotional things that could occur are you're more self-aware, you're more self-conscious, you may have problems regulating your emotions. Some things can frustrate you until you get really angry and have some outburst, or you could be crying and saying real sad and depressed. So those are just a few things that we talk about at the Brain Injury Association about situations you might get in after brain injury. So I want to tell you about the Brain Injury Association of North Carolina before I go. We have 5 offices throughout the state. You can call us at 1-919-833-9634. You can also go to our website at www.vianc.net. There at the website, you can look up statewide resources as well as statewide support groups. You can look up events that we are having and participating in. We have a conference coming up in a week, and you can go on our website and you can register and be involved. We're having great speakers, and I hope that you will take the time to check us out and come on and join. So for this time, I'll let you go. I'll see you right before Thanksgiving. Have a good day. Thanks for coming, and bye for now.